So at least we have very senior members of the fourth estate of the rep, which is very important. They're the watchdogs with civil society to make sure that some of these things we're talking about don't go into the forest and grow bush. You know, so thank you, Mr. Isuguzo. I hope I pronounced it correct. Isiguzo. 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 Okay. Interesting. All right. You're welcome, sir. All right. Yes. Still online, online participants. Please, can you, yes. I think Zachary Osheku, you're still there?
Yes, I am.
Yes, please, sir. Can we hear you?
Okay. Good morning, everyone. In fact, I'm so elated being at this forum where an important issue that concerns everyone is being discussed, which is the issue of universal health coverage in Nigeria. First of all, my name is Zachary Osheku. I'm the Executive Director of Primary Healthcare Initiative Africa, and universal health coverage is at the center of what we do. Recently, we launched a campaign which we call My Health Sure campaign. It's a sustainable community-centered advocacy on universal health coverage, because we understood that Nigeria, day by day, keeps moving down into poverty. And a lot of people don't have access to 3 square meals per day. So what we did was, okay, how do we leverage the amount of recyclables in our environment, which have congested our environment? So what we are doing currently is leveraging on recyclables in the environment in exchange for a health insurance. And the reason why we're doing this, because we believe the whole pursuit for a universal health coverage has to be holistic. In as much as we are pushing for political leadership, we are also pushing for private sector engagement, because according to the private sector landscape assessment by the World Health Organization, about 50% of people depend on private sector for their health pursuits. So if you look at all this, you don't need to leave anyone behind. The government have to play their role, and the citizens have to play their role. There has to be as much advocacy as possible. And finally, on the area of investment, in 2021, 2001, there was Abuja Declaration where all the African member countries met here in Abuja and unanimously agreed that 15% of the budget should go to health. And unfortunately, about 21 years thereabout, Nigeria has never had a budget of even up to 10%. So this is the best time for us to call for more investments in the health sector. Based on the assessment we do at the facilities, as we go in the field, we realize that some of the persons, the enrollees under the Basic Healthcare Provision Fund that were supposed to benefit from health cover, it will shock you. At the facility, they will tell you they don't have ACT anti-malaria. They don't have this. So why do you expect them to get quality care? You know, so we notice there is a gap between the facility and the medical store in most of all these states. So what that tells you, there is a funding gap in terms of procurement, supply chain management, and what have you. So it's an holistic process. Every hand needs to be on deck if truly we are serious in advancing the cause of universal health coverage in Nigeria. Thank you.
Zachary, for that intervention on your part. If I hear you very well, you're also looking at the issue of increasing funding for health, especially domestic funding for health with Nigeria as your particular area of interest. And you brought up the 2001 Abuja Declaration. Yes, we agree with you. It's actually very shameful that a country that hosted the thing has not moved an inch in terms of trying to meet up with that goal. That is one of the reasons why we're here. And I think that's part of what we're trying to do, get the political